We're sort of talking here tonight, as Kerry has sort of said, I'm a pharmacist and naturopath. Been a pharmacist for over 16 years, and of those 14 years I've been sort of compounding. Compounding means that we work with a multitude of different practitioners in sort of customising different forms. So I've always been in the area of customising and being around patient-focused types of processes. I've also completed my fellowship in anti-aging medicine. That also enabled me to look at sort of how we restore function back to people's health, and looking at some different areas in health optimisation as well. Also completed my advanced diploma in naturopathy, which again explored some other areas to assist patients as well. So my passion is in disease prevention. So I think disease prevention is very important because we can prevent disease and the onset of those processes if we're looking at the body systems correctly. Treating the person, not obviously the condition, because a lot of time, as medicine can sometimes do, is treating the tip rather than what's below the tip. So as we can sort of see here, you've got sort of diabetes, a lot of chronic conditions. It's where the dysfunction has happened below that may be important, and it can be a variety of different areas. As we can sort of see there, toxic emotion, so there's an emotional side to disease as well, hormone imbalances, inflammatory imbalance. So where do we sort of start? So there's a lot of testing that may need to be done, questionnaires, gathering information from patients is very important, and then designing a program that is specific to that individual to address some of these or a lot of these. And that's why I view practice needs to be integrated, because not all of us can sort of do everything there, and cross-referral is very important. So I believe disease can sometimes be dis-ease, so we can be at dis-ease, and it can be complex. There's genetics, there's environment, which can be toxins, viral exposure, bacterial, dietary. So diet is very important in that, and how it causes dysfunction to our system. So we've got to make sure clients are eating the right foods, the functional foods that are doing things for our system. As I've commented before, emotion is a big part to our view disease as well. So a lot of time we can hold emotion in certain organ systems, which needs to be relieved by different practitioners to therefore get a total wellness solution. Because we can give the supplements, but sometimes we need to be looking at the underlying causes and peeling back those onion layers to find out where things have gone wrong. And that could be at multiple system levels as well. So as we've sort of seen as well, that genes play a role in disease, and it's what we do environmentally or what we put in our mouth that can turn the genes on and off as well. So that's important as well. So everybody's different, and that's why we need to be looking at where the systems have failed. As I've commented before, working together in a total wellness solution environment is very important, and with like-minded practitioners. And that's why I feel that the environment here is conducive to that, because there is a multitude of different skilled people in different facets and areas that can bring together a health solution for individuals and customise that individual's needs as well. And I believe that's the process where true health restoration will exist. And no pun intended, but I think healthcare needs to be integrative, working together, and it needs to provide a solution to the individual. And I think it's a fantastic name, Integrative Health Solutions, but I think that is what is required for individuals to exceed in their health. Another area that I practice is what is called functional medicine, because I believe function fails before disease. So I believe that disease is the end result of organ system failure from a functional level, so functional meaning that how the body is operating. And we need to look at that level, and a lot of time blood chemistry, urine testing, so we need to be trying to find where the failures have occurred, and that can operate on different levels. So testing is important. I understand that sometimes testing costs a bit of money to be done, but it allows us to somehow solve the puzzle that may exist. Yet again, the reason why we test is to probably confirm what we think we know. So a lot of time by listening to the patient, getting a bit of a history, and that's why on my website I have questionnaires and information to gather history and information such as blood tests and information that then proves crucial to find out which testing may be better to be done to find the answers to maybe what has gone wrong. A new feature of my practice, which I've adopted in the last 6 months, is I believe, a sophisticated in-house testing modality, which is testing heart rate variability. It allows me to look at human biorhythms and regulatory systems. It looks at the sympathetic, which is the stress system, the parasympathetic being the rest of the system. We can't always be in high sympathetic drive. We know that parasympathetic is needed for rest and recovery and for your body to heal as well. So it also allows me to look at some of the hormone systems, mineral statuses. There's a psycho-emotional aspect to the information that I get as well, which is the chakras, the meridians. There's a multitude of pro practitioners here, better equipped in those areas than me, but so I usually cross-refer when I sort of see dysfunction in those areas for them to be worked on as well. So it allows me to, as a good reference point, to maybe be recommending other options and looking at people's systems as well. A large area of my patient database I see is adrenal dysfunction. So on the website as well, like I sort of said, there is information about what the adrenals do. I feel that they're critical in terms of overall health. They are the flight and fight system. So when you're overactivated, so when you're running away supposedly from the line, the adrenals can be overactivated. And I believe in an overactivated situation, that can cause dysfunction to your gut systems, your other hormones, and in a chronic situation that can lead to other diseases and symptoms as well. A lot of time we may see a patient that might have fatigue, craving certain foods, gut issues, and that needs to be all sorted out. So we need to basically make sure that the adrenals are always nurtured and supported as well, and that might be through nutrition, lifestyle interventions, and looking at what people are eating as well. I've been also adapted the last 6 months. Is what I do is also light therapy, which is pulsating light working on the third eye. That's helping to regulate the sympathetic parasympathetic system, so the stress system as well. It's light frequency working through the third eye, so the pituitary, which can have a downward flow effect on hormone status as well, and also listening to music as well. So it's using light with noise frequency to better balance the system. Obviously, there are other practitioners doing other therapies as well. That's an area that I thought I would sort of adapt as well. Another area that I tend to look at as well is detoxification. I think that's quite critical because we live in a toxic environment, and I believe we're all toxic to what degree we don't really know, but we can test to see that. I feel that saunas are quite good in terms of detoxification, but we need to make sure we're not detoxifying patients that can make them sick, even though detoxification can be good. It may be too quick, depending on their body system as well. So detoxification is retoxifying the system as well, so we must make sure that we know what the system is doing before we recommend certain therapies as well. So in the end, my way of practicing is patient-driven, patient-focused. It's about restoring health, and it's about a holistic approach to health. So it's embracing all the different modalities that exist and driving those from a patient-focused process. There's obviously information on the website, Integrative Health Solutions, and also on infinitywellnesssolutions.com.au under the consulting area about some of the things I've spoken about. I've got sort of questionnaires on there about the adrenal systems, supplements that I may sort of recommend as well. So feel free to look at that site in due course. Thank you.
Thank you.